Sonika.
Yeah, good afternoon, one and all. Thank you, guys, for this opportunity. So I'll start with a case. It's a 75-year-old lady presented with history of headache since 5 days to a family physician and was evaluated for the same. 2 days later, she developed left eye pain and redness, for which an ophthalmology consultation was taken. She had history of poor vision in the left eye since a year and a past history of right eye surgery 10 years back. No history of trauma, left eye surgery, or previous such episodes. Right eye on examination, right eye just showed a posterior chamber IOL. Left eye, there was PL present with PR inaccurate. Circumciliary congestion. Cornea showed edema with no KPs. The anterior chamber was deep with cells and flare with the presence of whitish material in the anterior chamber. There was RAPD with a hypermature cataract. The IOP on applanation was around 60 millimeters of mercury with no view to the posterior segment. The B scan showed few vitreous opacities just posterior to the posterior capsule with no other opacities or abnormities. So a diagnosis of phacolytic glaucoma was made. Now before coming to a diagnosis, we should keep differentials in mind like open angle glaucoma with uveitis, but lack of no KPs with a hypermature cataract goes in more favor of phacolytic glaucoma. Lens particle glaucoma asks for history of surgeries or any injury. Acute angle closure glaucoma, the anterior chamber depth will give you an idea. And the glaucoma associated with trauma. Management this patient mainly, the IOP was lowered with topical and oral anti-glaucoma medications, and topical steroids and cycloplegics were started. Pre-op mannitol was given and a manual small incision with IOL was done. Post-operative follow-up was good enough. By 8 weeks, the vision was around 6/9. The vitreous opacities has resolved and IOP was around 17 millimeter of mercury. Now what do we learn? Patients with lens-induced glaucoma may present to a physician for headache and vomiting and can be evaluated for other cases rather than ocular till they develop redness pain. Though PR inaccurate doesn't mean that patient will not improve his vision. Under guided prognosis, perform a lens extraction to relieve pain or inflammation at least. Now about the antivitreous opacities, many surgeons, they do a partial vitrectomy for rapid visualization. But these antivitreous opacities are self-resolving in phacolytic glaucoma in around 8 to 12 weeks. The surgical dilemmas here is when we ask whether we will do a ECC, SICS or phaco, which is the best. Now, there are many studies which have shown SICS being a good one, but phaco is also good, and the problems are mainly corneal edema and a capsule status. So finally, it depends upon the surgeon's experience and comfort. Now, last question is whether to go for when to go for a combined surgery in such cases. There are studies which have shown that one study shows mainly a duration of around, if the symptoms are less than 2 to 3 weeks, then just cataract extraction will give you a good result. There's another study done at CMC where the duration of more than 7 days and IOP uncontrolled, even on maximum medical management, they did a cataract extraction with a trab. I think because of lack of time, I would stop here. Thank you.
Thank you. Thank you, Dr. Sonika. I'll request Dr. Subhashini to give a comment on this case of lens-induced glaucoma.
Yeah, that was a good presentation on phacolytic, and you didn't move into phacomorphic, no? You also had a case on that. Yeah, phacolytic glaucoma mostly can be, the definitive management is lens extraction, and in these cases, most of the cases will not require an additional trabeculectomy surgery for control of the pressures. And actually those vitreous opacities, it's actually the fluidic lens matter which is found over the anterior vitreous face, so which gets absorbed over time, or some people even make a nick in the PC to just take out that liquefied lens matter. So either way, it's fine, but it's more than opacities, it's over the anterior vitreous phase.